segment of Delmarva Live is brought to you by Delmarva Dental Services.
You know, it was just last month that we visited Delmarva Dental Services to show you how Invisalign aligner trays work to straighten your teeth. So let's do a real quick recap here. Patients have a series of custom trays made that over a period of time will shift your teeth into the correct position. Now, because the trays are clear, they're nearly undetectable. Dr. Lee Aki of Delmarva Dental Services says more adults are choosing it as a treatment.
I think having a pretty smile, nice straight white teeth is something that a lot of people do wish for. Maybe they've had it in the past, maybe they just have seen other people with it, or it's just something that would make them feel more confident. So it's definitely something that a lot of children and adults both look forward to having.
And of course the Invisalign trays can be taken out so that you can eat or so you can brush your teeth.
Invisalign has been around for about 20 years, and in that time, it has become a game changer in the smile business. Well, today we hear from a couple Delmarva Dental Services patients who say this dental treatment has changed their lives. This is not the smile Jean Webster of Salisbury wanted when it came time for her daughter's wedding, so she did something about it.
My family had no clue what I was doing. I didn't tell them ahead of time, and some of them didn't notice until around New Year's or even later than that.
Jean had a lot of crowding. She had overlap of her upper front teeth. That was her primary concern.
So Dr. Lee Aki of Delmarva Dental Services created a treatment plan using Invisalign.
So when we did her treatment, we needed to create the space and actually kind of widen her arch in order to uncrowd those teeth and then give her a really nice full smile at the end of treatment.
I've just been so insecure about my teeth.
For Amanda Ermert, orthodontic treatment was something she always wanted as a child, but her parents couldn't afford it.
Well, Amanda is a young adult. She's on her own at this point, and this was something that she had always wanted to do. She had always disliked this particular tooth, and she finally said, you know what, I'm going to do this for myself, and she has never regretted one step of the way.
It's actually really easy. Like, I like it, honestly, because every time I get every 2 weeks I change my trays, and it's nice because every time I feel that tight feeling, I know something's moving.
And that movement has created a new sense of confidence in Amanda.
I love it. I feel so much more open. I'm in a customer service job, and I feel like I can finally show my true personality to people. You know what I mean?
Dorothy Barron had always felt self-conscious about a gap between her two front teeth, so she decided it was time to look into Invisalign.
Well, my daughter-in-law referred me, and she has them as well. And I've always wanted my teeth to look pretty, and I felt that now is the time to treat myself to the process.
She and I had talked for a while about possibly doing it. She said maybe she's interested, and then one day she said, you know what, I want you to do this for me. I really want to do this.
Dorothy's bottom teeth were also crooked, so she was fitted with trays for both top and bottom. She also had some cracked teeth that were taken care of during the process as well. She says it didn't take long for friends and family to notice.
I guess I really didn't myself because of looking at them every day, but as the weeks went on, everyone else that I knew noticed the difference in my teeth, and my husband as well.
She is a great patient. She always wears her trays, and every time she comes in, she says, oh, I'm so happy, it's moving, it's moving, it's closing, it's closing. And, so she could see the progress happening, and we could tell her that it was going right on track, and so she's very happy with her result.
Even though all three patients with similar issues with their teeth all got Invisalign trays, their treatments were very different.
Oh, so this is really tailored to your dentist or your professional, knowing your mouth, knowing the way your treatment is supposed to go, monitoring your teeth as you go through this treatment, checking your gums, making sure that everything remains healthy the whole way through.
What is the same is the feeling when their treatment is complete.
So how do you feel when you smile now?
I feel absolutely wonderful.
So much better. I just feel so much more confident. It's crazy.
I feel great. I mean, I would recommend it to anyone.
And Jean, who you saw there, who wanted to fix her smile before her daughter's wedding, was actually at the tail end of her treatment when that day came. But with Dr. Aki's blessing, she was able to take out the trays, enjoy the wedding, and then put them back in when it was all over.